So I wanted to kind of be a voice for those also that feel kind of like they don't have access or they fear going to the hospitals or fear seeking care.
I grew up in a rural part of Michigan, and rural communities face a unique set of barriers to care.
So this is a really interesting program that we just started. Really, it's a collaboration between the Morehouse School of Medicine's School of PAs and our physician assistants and Northern Light Health. And so taking them out of urban Atlanta and bringing them to one of our rural sites, I think will be a really good experience for them.
I thought like I wouldn't have phone reception. I thought it was just gonna be like tumbleweeds. It's like, okay, this is rural. This is what I signed up for, but this, I could live here. I could get down with this.
But I love the fresh air, the little bit of the slower pace of life, less traffic.
So I can just see like cardiology patients or like just patients with, I guess, comorbidities that I can like see and actually like treat. Like you read it on paper and it's like, okay, but like actually seeing a human.
I'm just looking to get some really wonderful hands-on experience, and I have every faith that I will get that here.
What we know is that most healthcare professionals, and that includes nurses, doctors, nurse practitioners, and physician assistants, that they practice very near where they had training experiences. So getting these individuals out of another state into our state, learning what our communities are like, makes it much more likely that we will later be able to recruit them to actually stay and work in those very same communities.